All right, welcome to Speaking Week and this session, which is focusing on pharmacists, vets, radiographers, occupational therapists and dietitians. If you're joining the session and are not one of those professions, you're still very welcome to be part of the session, and there's still definitely things that you can learn. And we will also be recording all of these webinars. So if you're a dentist, physiotherapist, speech pathologist, optometrist, or podiatrist, tomorrow's session is going to focus for you. But if you're a nurse or a doctor, then we're sending out replay links for those sessions in email to everyone who registered. And we'll also be making these sessions, which are, as I say, recorded, available on the OET YouTube page very soon. So everyone, as I say, is very welcome. It was good to see from the poll that I asked that we've got representatives from all of those professions that I'm going to be talking about tonight. And also I want to say hello to those tuning in on Facebook. So make sure you register via the link provided if you want to continue watching. So in today's session, I'm going to try and touch on a little bit of all of these professions. I'm going to share a brand new role card with you, which will also be uploaded to the sample test section of the OET website soon. And I'm also going to share examples from candidates completing the role play with me from around the world. So in the last 2 weeks, I've recorded role plays with 30 candidates from among more than 5,000 who expressed interest in doing this. It would obviously have been amazing to speak to even more candidates, and I'm sorry if you weren't one of those chosen. But I will use scripts from the role plays that I did record to demonstrate different strengths and weaknesses against the assessment criteria OET assessors use to mark your speaking test. Let's start off with a couple of poll questions, though, and these can be answered regardless of your profession. So the first one is about the resources that are available to candidates, and it's about which of the free official OET resources about speaking have you used. So the options are the OET Speaking Masterclass, our sample speaking test with feedback, which is available on our YouTube page, and also the profession-specific video on how to approach Speaking Sample Test 3, which is available on our website. So let me know which of those resources about speaking that have you used. Okay, that's really good. A lot of you say that you've had a look at the sample speaking test on our YouTube page, and quite a few have used our masterclass video, but not that many of you have actually seen the profession-specific videos about how to approach sample test 3. So if you haven't, you need to head over after this session or in the next few days to the prepare page of our website to take advantage of all of those free resources, which you can see with the arrows on the screen are directing you to where you will find them from our prepare page. Okay, the next poll question is all about how much you are practicing patient conversations. So it may be that you are having a lot of opportunity to speak in English, but you don't get so much opportunity to talk with patients or to have this kind of patient conversation. Or maybe you don't have any opportunity at all to practice this because you haven't got someone who can assist you. So let me know. There's no right or wrong answer to these questions. It's just getting an understanding of your experience. So the answers are coming through fairly evenly, actually, of the people attending tonight. We've got roughly a third for each answer option, slightly more saying I'm speaking in English very regularly, but I don't get opportunity to practice patient conversations. So if you are working with patients in English, then you are obviously really lucky in having multiple practice opportunities. But for those of you who don't, there are still ways to practice conversations with patients, which just require a little bit of time from a colleague, a friend, or family member. And in the video that I mentioned in the last slide on Speaking Sample Test 3, I actually give you some tips about how you can practice patient conversations, even without a role card, and certainly using the support of friends, family, or colleagues. Okay, and then the last question is all around the OET Speaking assessment criteria. So have a look at this question. How confident do you feel about the speaking assessment criteria? And again, please feel free to be honest. It's quite okay if you say you haven't seen the criteria or you're not really sure about them. Again, this is just for us to get some indication of how confident you feel with them. Okay, so as I would probably have expected, the vast majority of you are saying, I have a general idea, but I'm not really sure about how I compare against them. Quite a reasonable number, though, of you are being honest and admitting that you haven't seen the criteria. So that's really something that I want to change after tonight's session, because the OET assessment criteria are so important to your success on test day, and here they are showing up on your screen, and the link on the screen is where you can go and find them after this session. So obviously OET is a language test, and you're only going to be able to score the grade you want if you are evidencing each of these criteria to a high level. And if you're not sure what the criteria are or what the assessors are looking for, this is something you obviously really need to fix quite fast. This session is going to be a good start, and I'm certainly going to spend the first half of the session going through the different criteria to make sure you have a better understanding of them. But do make sure you head over to our website, to that link after the session, to download the criteria from our website, or save them to your favorites, or perhaps even print them off, stick them on your wall. And ideally, you should also do the same with our writing assessment criteria, which you'll find in a very similar place on our website under the writing section, obviously, rather than speaking. So to score a B grade in your speaking test, which is the score that most of you are aiming at, you need to score mostly 5s from the linguistic criteria and 2s for the clinical communication criteria. And I'm going to go through each of the criteria in more detail to make sure we're clear about what this means for your speaking performance. And I'm going to focus at the level which is a 5, or the level which is a 2, which means a competent user from the clinical communication criteria. And I'm going to evidence it with examples from those candidate role plays. So the first of the criteria is intelligibility, which means your speech is easily understood with what is called minimal strain for the listener. And my best way of explaining strain is the expression on that emoji you can see on the screen, a sort of puzzled, confused sort of face. But to be honest, the patient or interlocutor might not always show the strain on their face because it is a little impolite to sort of show that expression. But instead, internally, their mind will be turning, trying to understand what you have said. Another indicator that there is strain is if the interlocutor doesn't answer the question as you expect. Perhaps they just say, yes. This is something we do in English when we know we've been asked a question, but we haven't understood and don't like to ask what you meant. A final part, which is in intelligibility, is accent. And while it's fine, it's absolutely fine to have an accent and to make some pronunciation mistakes, a heavy accent or significant pronunciation errors for the task would reduce your score here. So let's look at an example. Here, the parent has asked the pharmacist about the syrup he's suggesting for her son. Parts of his answer is clear, but when he names the active ingredient, it's actually unintelligible. And you can see that this is how the interlocutor feels, that confused face in their response of, okay, okay. They haven't really been able to understand because they haven't been able to pick up or hear the word that the pharmacist has said. For fluency, this means you are fluent at normal speed, and any hesitation would be due to the natural process of thinking and speaking at the same time. So you may occasionally repeat yourself or self-correct what you have just said, but the amount of times that you do this wouldn't confuse the patient. And the words normal speed are really important here. This, of course, can be different depending on what you're discussing with the patient. So imagine explaining a process to a patient or giving them results of a test. Would you talk about those two things at the same speed as you would when asking questions or answering a routine question that they have asked you? No. So you need to make sure that your speed is appropriate for the content. In this example, the vet is trying to reassure the client about the surgical procedure she's recommending for the client's rabbit. But the meaning is made a little bit unclear by the amount of repeated words and self-corrections. So you can see that right at the beginning of the vet's response. She's saying, it sounds like, a bit like, a bit like, not nice or familiar. And then it becomes a bit more fluent after that. But that sort of opening of the response is quite difficult to understand, and certainly shows a lack of fluency in the amount of times the vet is having to self-correct or repeat words. For appropriateness of language, this is really covering your level of formality, your tone of voice, and whether the vocabulary choices you make are mostly appropriate for the scenario you are discussing. So formality may be different depending on whether you have met this patient before, according to the background information, the age of the patient, or their healthcare needs. And similarly, you use different tone of voice when you are showing empathy or reassurance to firmly advising the patient to do something. Your vocabulary choices are linked to the function of what you are discussing. So, for example, whether you are advising, asking questions, or reassuring. Occasional mistakes in these areas are okay, but overall, you need to match these things well to the role play. And this example from a pharmacist is actually a good example. So it's demonstrating appropriateness of language well here. So the pharmacist is responding to the parent's descriptions of her son's symptoms, used a friendly tone and friendly vocabulary choices. And we can see that as an example of him saying, we can just take it slowly. It shows the parent that he feels that together that they are a team. And he also says, like, no reason to panic, really. Like, I think is just a normal cold. Even though he's being friendly, it doesn't lose any of the professionalism. And he even comes back to that a little bit later in his explanation and says, my professional recommendation would be. So it's good to be friendly. It's good to have a warm tone. You can still do that while maintaining your professionalism, but it's a really good way of showing appropriateness of language. Then we have resources of grammar and expression. So you are able to show the assessors that you can be flexible with English, that you have the grammar and vocabulary necessary for this situation and to respond to the patient. And that, of course, means demonstrating different tenses, maybe conditional forms, phrasal verbs, maybe occasional colloquial or idiomatic phrases. But you shouldn't think of them as a tick list that you can simply tick off once you've used them a single time per role play. Instead, like the images on the screen, think of them more like a filing cabinet that you pull out and download whenever they're needed and as many times as they're needed. It's not just a one-time download or one-time use. Occasional mistakes are okay, but in general, they shouldn't prevent your meaning from being clear or the conversation from continuing smoothly. So here, the occupational therapist is explaining the purpose of today's conversation to the parent. Her language isn't perfect, but she's demonstrating flexibility with the grammar form she uses, and her language choices are suitable. So it is, as I mentioned, possible to make some mistakes, but still end up with a 5 overall. The purpose of this criteria is to demonstrate that flexibility of being able to use language correctly and appropriately. So let's now look at the clinical communication criteria, and there is, to be honest, quite a bit of misunderstanding about these. So compared to other English tests, these are not criteria you will have been tested on before. Obviously, you're very used to demonstrating all of the linguistic criteria, which we have just looked at, the previous 4 criteria, and you would have been familiar with those even before you reached testing standards. So while you were learning English at school, for example. But just because you haven't been tested on these before, there's no excuse to not being familiar with them. The clinical communication criteria aren't weighted so highly as the linguistic criteria. So they're scored out of 3 rather than out of 7. But there are 5 of them, and it's pointless to throw away scores. Another misunderstanding about these criteria is that they are assessing medical knowledge, probably because of the word clinical in the title. However, that isn't true. These are communication criteria in a clinical context, or in other words, important communication skills which healthcare providers need, which is separate to the actual medicine that they are discussing. I'm going to go through them one by one, and hopefully you will be able to see what I mean. So the first one is relationship building, and the ways you can evidence this is by starting the role play appropriately by introductions where needed, or maybe a greeting, and perhaps establishing the purpose of the conversation. Showing respect for the patient and their situation, and not judging their opinions or attitude towards their health, even if part of the role play is for you to try to change their attitude. Another important part is showing empathy for the situation the patient describes, or what they tell you, both in the words that you say and in the tone of voice you use in your responses. These approaches to the conversation help the patient feel like you are on their side, that you understand them, and that you will work with them as a team to address their health needs as best you can. So in this pharmacy example, the pharmacist introduces herself and makes use of the background information to start the conversation directly, but by asking for more information about the child's symptoms, which is the first task of the pharmacy card. In the second example, on the right-hand side, the occupational therapist also introduces herself and checks with the patient what name they would like her to use before then moving on to an open question. The second clinical criteria is understanding and incorporating the patient's perspective, which means asking the patient to tell you about what is worrying them or what they feel comfortable to do, or if they tell you this information without you needing to ask, asking follow-up questions to make sure you fully understand or respond in a way to show you have listened, by maybe including some of what they say in your response or in an explanation you give later in the conversation. It also means noticing how the patient answers your question or tells you information. Do they use language to show they feel uncomfortable, anxious, or embarrassed? Do they use words that sound like they agree, but from the tone of their voice show that they don't really? So, for example, maybe, or I suppose so. Here, the patient is telling the occupational therapist that they feel guilty about having had to take time off from work and how this impacts her colleagues. The occupational therapist picks up on this and validates this feeling of guilt by saying it's completely natural when people have to balance work and family issues that they feel this way. Providing structure means taking responsibility for the conversation and the content you want to discuss with the patient. And there are a number of different ways to do this, including signposting that one discussion point has finished and a new one is starting by naming the new point you want to start talking about. Or you can check if the patient requires any clarification before introducing a new point, or just make a clear pause and intake of breath to show a change of direction. Other organisation techniques include offer a summary of a process of what has been agreed, or by adding intensifying language such as really important or essential that you do this, to help the patient understand what is more important from less important information or advice you might also be giving. In this example on the left, the radiographer is summarizing what has been agreed with the patient at the end of their conversation. So go back to the waiting room and I'm going to make a call to the doctor. While in the vet example on the right, the vet starts to explain the desexing process, realizes it would be good to check the client is ready to hear this information, and then once she has this approval, uses signposts to provide her explanation. First, after that, and then, and so on. In information gathering, the skills are all about assisting the patient to be part of the conversation. Now, it may seem a little counterintuitive in a speaking test that you should be encouraging the patient to talk more, but it is important that there should be a balance. After all, it's rare when we are speaking to another person that we do all the speaking and they do all the listening. In real life, and certainly with patients, speaking is a two-person process, and we can complete the conversation more effectively if the other person is actively involved in this. To do this, you need to give the patient opportunities to speak by asking open questions first, so they tell you the situation in their own words, before clarifying what they've told you using closed questions. When they are speaking, showing that you are listening by not interrupting or providing encouragement through sounds like, right, and then responding using some of what they have told you or giving a summary of what you have understood are all good ideas. It also means making sure you have understood what they said by asking for clarification when it's unclear, or, as we looked at before, when their words suggest one thing but their tone means something else. Finally, it also means avoiding asking compound questions, or in other words, 2 or 3 questions in one go. An example of that would be, can you tell me about how long you've had these symptoms, how severe they are, and any medications you've tried? Or avoiding leading questions, which suggest the answer to the patient rather than them letting them answer the question in their own way. So here, the occupational therapist needs to find out if the patient is ready to return to work. And she does this with an open question. Do you feel you're ready to return to work? And that allows the patient to give her answer and reason. The therapist then moves on to closed questions to discuss care options. Now, this is an example of a compound question, like, are you the only carer of your dad? Do you have any siblings or other relatives to help? But the two questions are quite linked, so it's not as bad as the example I just gave of a compound question. It would still be clearer, though, if the therapist had asked them individually. And the final clinical communication criteria is information giving. And in contrast to information gathering, this criteria is about how you speak and provide information in those parts of the conversation where you need to do this, when explaining options, giving advice, and so on. But it's still focusing on how you include the patient in these sections. For example, by finding out how much the patient knows already about the topic, so you're not giving them unnecessary information, checking they have understood, and that you have provided sufficient detail for them to feel clear about the situation. Asking them explicitly if they feel comfortable with what you have said, and if not, to feel safe to share their concerns. Another option is that pausing is really important here. You must remember that the situation you're discussing with the patient is likely to be the first time they've heard it. And if you rush through everything, they will miss important details or just end up feeling worried and confused. Watch their face. This is a good indicator of whether they are relaxed because they are following what you are saying, or feeling stressed because you're providing the information too quickly. Here, the pharmacist is explaining some non-medicinal options the parent can use. She provides a simple option and reason to use it, and then checks if the parent feels comfortable with this idea before continuing. So now we have gone through each of the assessment criteria with some examples. I want to share with you 5 top tips that are suitable for every profession that came out of completing the role plays with the 30 candidates, as I did in the last couple of weeks. So my first top tip is how you start the conversation is really important. And if you're not clear about anything in the card, you should ask this during the preparation time. Read the background information carefully for clues as to how you should start the role play. The second top tip is don't rush. So the conversation is much more important than completing all of the tasks. This is supposed to be a real patient, and they need to understand and be included in the decision-making process. My third top tip is about the information provided in brackets on the role card, which is optional. You don't have to use it at all, and if you do decide to use it, you may need to alter it or think about how and when you say it to keep the patient feeling comfortable. Tip number 4 is not to add to the tasks. So even if your healthcare training tells you to take a complete history or ask additional questions, for OET purposes, if it's not on the card, you don't need to do this. You don't need to add to anything to what is already there on the card. And finally, tip 5 is if you use healthcare terminology, make sure you explain it to the patient or check that they are familiar with it, and use lay language whenever possible. So in the past 2 weeks, I recorded conversations with some pharmacists, occupational therapists, a vet, and a radiographer. So for the rest of the session, I'm going to spend a few minutes on each of these professions using examples from our recordings. Unfortunately, I wasn't able to find a dietitian to record. So if you are a dietitian, hopefully you will still be able to learn from the general advice that comes with the examples, and you will still have your own role card to practice with from our sample test page by the end of the week. The same is true for any nurses and doctors who are on the call as well. So I'm going to start with the pharmacy role card, and I'm just going to provide a few details for it, and I've highlighted it as you can see on this slide. So the setting is a suburban pharmacy, and the background information tells us that you are speaking to the parent of an 18-month-old boy who has a cold. The boy's symptoms are described, and we know that the parent is asking for cold medicine or decongestant. So there are 5 tasks on this card, but because of the timing of tonight's session, I'm just going to focus on task 1, which is to find out details about the child's symptoms, and task 3, which is to resist the request for cold medicine because there are some interesting differences about how the candidates approached and completed these tasks. So a few of the pharmacists were more successful than others in making use of the background information to start the role play. This is the first time the pharmacist has met the parent, but it's fine to use the background information to start the role play and help you get onto the first task as smoothly and quickly as possible. So here are a couple of good examples. So the pharmacist on the left makes appropriate introductions, introduces themselves and how can I help you, and then moves on to asking about the child's symptoms. The pharmacist on the right also uses the background information well, introduces himself and moves straight to task 1. This example on the next slide, though, is less successful. This pharmacist asks questions about the background information rather than taking this to be information he already has. He also starts to try to take a complete history of the child. So as well as the questions you can see here on the screen, a little bit later, he's also still asking questions. So for example, whether the child has additional symptoms, if he's been diagnosed with asthma or a lung disease, etc. So this would be a situation where the candidate is adding tasks to the card. And it's something that I picked up on in the feedback that I gave this pharmacist, that although in their training to take this sort of history is normal, for the purposes of OET, it's unnecessary and you only need to complete the task given on the card. For task 3, candidates had to resist the parent's request for cold medicine. And here are 4 examples of how they did this. So in the chat box, I'd like you to let me know which of those 4 options do you think was most successful in resisting the parent's request? And just to explain very briefly why you think it was most successful. So 1, 2, 3, or 4, which one do you think is the best one? And why do you think this is most successful at resisting the parent's request for cold medicine? Who wants to suggest an answer? Do you think 1, 2, 3, or 4 is the best option for resisting the parent's request? Someone is suggesting number 1. Someone else number 3. Few more for 3. Yep, most people are saying number 3. All right, so let me just give a little bit of feedback about each one. So number 1, this pharmacist praises the parent for their action and gives a simple explanation as to why it's not the right choice. It could be improved by personalizing it more to this parent and her son, rather than talking in quite general terms of children. Pharmacist number 2, this one could do with a reassuring phrase after the first sentence. So based on what you said, it's a normal cold, and this is my recommendation. So some reassurance could be good. And also the use of pediatric, and the second sentence in general sounds a little medical rather than being centered to the parent and their situation. Number 3, which a lot of you are suggesting is the best, provides a lot of reassurance at the start, and that makes the parent comfortable that their son is not in any danger. And then she also gives an explanation why the medicine isn't the right choice. So I'd agree this one is the better one. But again, this pharmacist could also make it a bit more personal to this parent. So rather than talking about children in general, it's not suitable for children of your son's age. And finally, number 4, the first part of this response is quite technical, and it is clear enough, but it would be better if it was slightly less technical. The second part of their response is more reassuring and then does use lay language. All right, let's move on to occupational therapy now. So here on this card, the setting is an occupational therapy rehabilitation centre, and the background information tells us that you are talking to a 45-year-old pharmacist who's been on sick leave for a month due to stress, which has been caused by looking after his or her father who has dementia and working full-time. And the doctor has recommended occupational therapy before he or she returns to work. There are also 5 tasks on this card, but I'm going to focus on task 2, which is explain the common causes of stress, and task 5, which is strongly recommend talking to family members and advise on stress management techniques. So the 3 occupational therapists I spoke to were all very similar actually in their abilities and performed well in the role play. Let's look at how they approached task 2, which was to explain the common causes of stress. So we can see that the occupational therapist on the left and the one in the middle both listed the common causes of stress. and then used what the patient had told them to identify what they understood to be her main cause of stress. So they both asked, it sounds like this is related to your family member. Is that right? Or do you think your father's illness would be the main cause of your stress? The third occupational therapist also used what the patient had told them to summarize what was causing the stress, but didn't mention that this is a very common cause of stress. So this was slightly weaker than the other two, because the task was to explain the common causes of stress. For task 5, only 2 of the occupational therapists had time to cover this. The other occupational therapist had perhaps spent a little too long explaining the purpose of the conversation at the start, which technically wasn't one of the tasks, and so didn't have time to get to task 5. So again, this is something I've mentioned as one of my top tips. Only do the tasks on the card to make sure you have as much opportunity as possible to get through all of the tasks as you can. So of the other 2 occupational therapists, which one do you think did the better job? The occupational therapist on the left or the occupational therapist on the right? And I appreciate there's quite a lot of detail on there, so it might take you a few seconds to read it, but just get a sort of general idea. Do you think the left option is better about recommending talking to family, or the option on the right? Which one do you think is the better response? So Jenny has suggested the one on the left is more successful. And Fifi has also said the first one, the one on the left. Maha, though, says the one on the right. What do you think makes the left or the right more or less successful? Okay, so most of you are suggesting the left. I would agree with you. I think the occupational therapist on the left is a little bit more successful. And the reason for this is she's using more of her own words rather than just those that are given on the card. And she does make it clearer that her suggestion is a strong one. And you can see in the task, it says strongly recommend. So she says, getting social support is really important. I'm concerned, and it would be good to try. So those are good at completing the first part of task 5. She does only mention the regular routine as a strategy, but builds it out so it is something as a clear strategy rather than just giving a list of choices. The occupational therapist on the right repeats the suggestion to talk to family in more than one of her responses. But if she'd added strongly or I really recommend, this would then be a better match for the task on the roll card. She's also really just listing the information in brackets on the roll card to provide stress management techniques. Now, as I said, the information on the brackets is there for you to use if you want. It's optional, but you need to demonstrate to the assessors that you can use that information. Don't just read it as a list. Add your own words to it, or even just put it into your own words completely to demonstrate that you have that ability and flexibility with English. All right, so let's now move on to the vet task. Now, the vet task is set in a veterinary clinic, and the background information tells us that the vet is talking to the owner of Larry, a 2-year-old male rabbit, and has come to discuss Larry's recent aggression. There are also 5 tasks here, and I'm going to pick out some of the points about task 2, explain possible reasons for the rabbit's aggression, and task 5, reassuring the client about the procedure and outline the benefits of desexing. I was only able to speak to one vet. It was still great to be able to do that. So I'm going to show you how she managed task 2, which was to explain the possible reason for the rabbit's aggression. This response, I think, demonstrated a bit of confusion for the vets. So on the roll card, it had in brackets some possible reasons for the rabbit's aggression, and these were defending his territory and behaviour of the children. Now, the children in question were actually the client's children, but there was no mention of them on the vet's card. So I can see from the response that she made here that she thought children meant the rabbit's children. It's not a big problem, and it didn't cause a breakdown in conversation. Although when myself as the interlocutor mentioned that, no, it's actually my children, I'm worried about them teasing the rabbit, it seems that the vet maybe didn't understand that word tease or teasing, which the client used, because you can see that she simply responds yes before moving on to explain other reasons why rabbits may develop aggression. So if she had understood that question, I'm worried that it's because they're teasing him, it would obviously have been better to make some response to the client's query before moving on to talk about other reasons for aggression. For task 5, where the vet is trying to reassure the client about the procedure and to outline the benefits of desexing, you can see that just before the vet's response, the client has suggested putting the rabbit down rather than putting him through the procedure. And the vet does a really good job here of validating the client's concerns about the procedure. She agrees that it sounds a bit not nice, and then reassures the client that the procedure is quick and painless. He won't be able to feel that pain, and it will just be a matter of like few minutes. And she repeats these to emphasize the point. It means that she doesn't have much time to cover the benefits, so this is a bit rushed in the last sentence. But again, this wouldn't have caused a problem to the vet's overall score because the rest of the tasks had been completed. She hadn't added anything that wasn't already on the card, and she'd been responding well to the client's questions. So in this case, as I mentioned as another of the top tips, don't rush. The conversation is more important than completing all of the tasks. So it is really a balance about those two things. Complete as many of the tasks as you can, but don't sacrifice the conversation just to get through all of the tasks. That will always remain the most important part. And finally, we'll have a look at the radiography task. So here is the radiography card. And the setting is the radiography department of a public hospital. And the background information tells us that a 35-year-old patient has been waiting an hour for the results of their abdominal X-ray. And he or she has asked to see you because he or she is anxious and wants to know what you can see in the X-ray. Again, there are 5 tasks, which is a fairly standard number, as you're obviously seeing from the cards that I've looked at today. And I'm going to focus on tasks 1 and 2, find out the reason for the patient's request to see you, and apologise for the long wait, as well as task 4, which is to explain the purpose of the X-ray and advise the patient to discuss it with his or her GP. So like with the vets, I only managed to speak to one radiographer. And here is her response to tasks 1 and 2, which are to find out the reason for the patient's request and apologise for the long wait. So in the chat box, let me know, how successful do you think she was at doing this? Do you think she was successful in finding out the reason for the request and making an apology? Or is there something, if you'd had to do this task, you would have done a little bit different? What are your feelings about the way the radiographer completed this task? Do you think she did a good job? about finding out the reason for the patient's request and apologising? Or would you have done it a little bit differently? And if you would have done it a bit differently, what is your suggestion? Mohammed is saying, yes, it was a good job. Nikos said, not good, didn't really find out the reason. She talked more about other things. Thithi suggests she needs more reassuring. Maha's saying maybe if the radio is normal, he could reassure the patient. That's a good question, Maha. You can only reassure the patient if that is part of your card. So it's not necessarily something that you can do. Okay, so a bit of a mixed bag. Some of you are saying this was good, and others saying it could have been better. So I think I'd agree that there are some good parts, but also there is definitely some things the radiographer could have done a bit better. So the introduction was okay, but if you remember from the roll card, this patient had been x-rayed by you an hour ago. So obviously if the radiographer hadn't introduced herself again, or instead of saying, how can I help you today, she just said, how can I help you? That would have been a better match for the roll card when it says 1 hour ago you performed an abdominal x-ray. So perhaps a better alternative would have been, hello again, I understand you've asked to speak to me, what can I help you with? She does do a good job of apologising for the wait and provides reasons for why there has been a wait. But then she doesn't give the patient an opportunity to respond to her explanation, and instead just carries on to explain her role, which is actually the next task. It would have been good to allow the patient a chance to respond, particularly after you've given an apology, because that gives the patient an opportunity to accept your apology. Or if they're still unhappy with what you've said, they can explain their concerns or frustrations. So it is a good thing to do, which I think would have been better or made this response better in this case for the radiographer. Task 4 was to explain the purpose of the X-ray and advise the patient to discuss this with his or her GP. So you can see on the left that the patient asks, sorry, not on the left, at the top. You can see on the top that the patient asks the radiographer what the doctor will be looking for in the X-ray, which is a nice clue to the radiographer to start task 4. But the radiographer misses it and instead focuses on what the patient has said about her anxiety about having to wait. And so a little bit later in the conversation, the patient repeats the question again, and this time adds, are you not telling me something? So we can see the patient's anxiety has been raised by the fact that the radiographer has missed that question. And it seems like they've just missed it. They haven't sort of purposefully ignored the patient's question, they just missed it. But a missed opportunity can also create problems for you as a professional, because in the patient's mind, they're thinking, oh, they're ignoring my question. Is it because there's something wrong? So that's obviously something to take into account. This time, the radiographer does provide a good example, a good answer. They say, you know, what the doctor will be looking for. But she doesn't quite follow that through with a recommendation to discuss it with their doctor. They just sort of really answer the first part of the card. So, having looked at some real candidate responses to the different role cards, in summary, every candidate will have different strengths and weaknesses. And that's absolutely fine. there isn't one perfect way to complete a role card. How we speak is something quite personal to us, and the way that we talk to patients is also very personal. And so it's about you demonstrating how you would speak to the patient while trying to demonstrate those communication criteria we looked at earlier. So what is most important is that you do evidence the criteria to the assessors. And so making sure that you have a copy of them and listening perhaps again to this recording to understand what the assessors are looking for is a really valuable part of your preparation, just as valuable as doing practice role plays with a friend or colleague. Remember that OET is a language test, so you're not being judged on the accuracy of the medical information you provide. And finally, your assessment is across both of the role plays. So you will complete 2 role plays in your test, which does give you the opportunity to make up for any weaknesses in one or other of the role plays. So that leaves us with around 10 minutes for me to answer questions about the speaking test if you have them. Primarily, I would like to answer questions from the professionals that I've been focusing on today. But if it's a general question that applies to all professions, I'm also happy to answer those questions. And as I mentioned at the start of the webinar, the session is being recorded and you will be emailed a replay link to the session if you weren't able to see the beginning or if you'd like to listen to it again at another time. I can see a couple of you have suggested alternative ways to start the radiography task. So Mohammed, your suggestion is good, but remember, because the radiographer had already seen that patient, there's no need to introduce yourself by your name again. The second, sorry, I'm not quite sure how to pronounce your name, but starting with the apology and to know what are the concerns, that's definitely an option. Omar is asking what happens if I stutter. So it depends on whether this is a diagnosed stutter, something that has been sort of clinically diagnosed, in which case you may be able to request special arrangements when you apply for your test. However, if it's sort of normal nerves and hesitation, then obviously that's taken into account. We don't expect your speech to be perfect, as you saw when I looked at the level of the assessment criteria you should be aiming for. You don't have to be perfect. So a little bit of stuttering, nervous stuttering isn't a problem. Maha says, are there 2 parts for the speaking test or just one? Yes, you're correct, Maha. There are 2 role cards used in each speaking test. Thithi says, tell me more about the time limit. So for each of the 2 role cards, you're allowed 5 minutes to try and complete the conversation. As I've mentioned, it's not essential that you complete all of the tasks within the 5 minutes. And before the 5 minutes starts, you have 3 minutes to prepare. And during that time, I really recommend, if there's something that you're not familiar with, there's a word you don't understand, that you ask the interlocutor during that time, because they can define or pronounce a word from your role card if you need help with that. So Mohammed, the beginning of the session, perhaps you missed it, covered the assessment criteria, which is used to score your speaking test. And 2 assessors use those assessment criteria to independently score every candidate speaking for both role plays. And then a combination of those scores is what ends up going into your final grade. Waka says, how to avoid stuttering being mistaken for searching for words. I'm not sure exactly that you can, to be honest, Waka. Everybody stutters. In fact, I've noticed when I've been creating the scripts for these role plays that myself as the interlocutor has at times, quite frequently, repeated words, because I'm also thinking on my feet. The interlocutor is also taking the role of a patient, doesn't have a script to follow. They are thinking on their feet. So I wouldn't say that's terribly important, as long as you have periods of time when you're speaking where there isn't a lot of hesitation. You do need to have good periods of fluency, as well as maybe at the start of one or other response, you make those sorts of nervous hesitation sounds. Lysel says, is there any minimal number of tasks to be done in case we don't finish all of it? No, nothing like that. Obviously, the purpose of giving you 5 minutes is to make sure that the assessor has sufficient content to be able to score your speaking. And so the tasks are there to hopefully give you sufficient content to continue the conversation for 5 minutes. But I did say it's more important to have a successful conversation with the patient than complete all of the tasks. So if you only complete maybe 3 of the tasks, but do them very well, and it's a successful conversation, you haven't added anything that wasn't on the roll card, then it wouldn't necessarily count against you that you hadn't completed the last 2 tasks. If you haven't, or if you want to receive recordings from Tuesday and Wednesday, and you weren't registered in advance for those sessions, we will be adding them to the OET YouTube page soon, probably early next week. So you'll just need to hang on a little bit longer to get those videos from our YouTube page, but we will be adding them there. Roger says, is it okay if I didn't start the role play according to the task? It's not the end of the world, but I think, as I demonstrated in the examples tonight, it can mean that the conversation takes a little bit longer to get going, or perhaps the interlocutor will respond in a slightly different way. I think generally I was quite kind to the candidates who I was practicing with. But for example, the radiographer who introduced herself to me, I could have been a little bit frustrated and said, you know, have you forgotten who I am? You only x-rayed me an hour ago. So I think there is a risk, if you don't start the role play using the background information, that you could make things more difficult for yourself. But simple terms, it's not necessarily going to have a huge impact on your overall score. Safina says, what if there is a task that doesn't really need explaining? Can we briefly touch it and move on? Absolutely. Some of the tasks don't really require very much at all. So again, in the radiography example, the task was to find out why the patient wants to speak to you. So that's really just a simple question. How can I help you? Or what would you like to speak to me about? And then the task is done and you move on. So one of the other tips that I would recommend, that wasn't one of the 5 that I mentioned today, is during your preparation time, just making a note in your mind which of the tasks can be done very quickly and which of the tasks are going to need more time. And that will just help you manage your time better and move quickly through those ones that can be done quickly and spend longer on those that need to have more time spent on them. P is saying, can you give 2 or 3 examples of a signposting phrase, please? So the really obvious examples of those are when you use firstly, secondly, or after that, or perhaps you might say, I want to give you 2 options. Option number 1 is this, option number 2 is that. So it depends what you're talking about, but if it's a process, certainly to use firstly, next, thirdly, you know, those sorts of words is fine. Or maybe, as I said, to list a couple of options and then to go through each option in turn. Ellie says, what if the interlocutor asks the same information again after you have just explained it because it was a question later on his card? So I guess this could happen. I think in most cases it wouldn't, but that could easily happen in real life, that the patient asks you something that you feel that you have just answered. So it could be genuine that the patient doesn't realize that you've answered the question and so asks it again, or perhaps it's something they're particularly worried about and that's why they ask it again. Or it could be related to the card and they feel like they need to follow the card very strictly. So don't panic if that happens. Just answer the question again. Perhaps you don't need to answer it quite so fully as you did the first time. But just answer the question again, and then you can move on to the next task that you want to discuss. All right, I'm going to pick on one last question, and then we will need to finish for today. So here is a student saying, I'm taking my test early next month. Is there any final advice? I'm a bit nervous. So I certainly found when I was recording the conversations with the candidates in the last couple of weeks that they also were quite nervous, even just doing a practice recording with me. So I would obviously try to put them at their ease, make them feel comfortable. And that's what the interlocutor will do with you as well at the start of your speaking test. So before you get into the first role play, there's a period of time where there's a warm-up section which isn't assessed. And this is like what I did as well with the candidates. I asked them some general questions just to help them sort of relax a little bit and to become familiar with your voice. So feel reassured by that. The interlocutors are there to assist you with the test and to complete the role plays with you. And once you are actually doing the role plays, my best advice is really to try and forget that it's a test and try and imagine this is really a patient with some healthcare needs, and put yourself in your usual workplace role and respond to them as you would if they were a real patient. And I think if you can forget about the test, that's going to help you relax and to do well with your speaking. So one final reminder, if you would like a recording of this session, it will be emailed to you later. If you're looking for a recording of Tuesday or Wednesday, then those will be available from the OET YouTube page, probably early next week. I'll talk to our marketing team about it, and I'm sure they'll make it available as soon as they can. The sample roll cards should be available on the website by the end of the day tomorrow. So you'll be able to head on over there and pick up the cards that you've seen tonight or the card for your profession. Thank you so much for joining me today. Perhaps I might see some of you at the session tomorrow, which is focusing on the remainder of our allied professions. But otherwise, have a good day, take care and keep safe. Bye for now.